Janelle Marie, welcome back to Body Beautiful. With us today, we have plastic surgeon, Dr. Joseph Mealy. We're talking about a bunch of different topics today. And you know what? Remember, this is a medical show. So if you got kids in the room, we're going to be showing before and after photos. We're talking about Brazilian butt lifts next. So just to let you know, couple seconds, get the kids out of the room. All right, so Dr. Mealy, and remember, of course, talk to your own physician first after the advice.
Always good to get
Always good to get advice.
Pertinent to your body.
Absolutely. All right, Brazilian butt lifts.
Sure. Huge
now. People are coming, Kardashians, we got everybody going for the butt, right?
Well, it's a change in focus, I think.
From
a time when we didn't have as good of procedures to even address the area.
I got you.
Because previously we had buttocks implants. But a lot of times the early buttocks implants were just breast implants that were being repurposed.
Oh, that's terrible.
So they weren't the right shape,
No.
they weren't durable enough, and they tend to ride high. They tend to give us a shape that we don't really like as much. With the advent of fat grafting, you can kind of put the fat where you want it, and not only change the size, but the shape of the butt.
All right, so Brazilian butt lift in essence is what, surgery-wise?
Essentially, it's liposuction with the fat put where we want it.
Okay, so liposuction out of other places of your body.
So you have to have some fat to take.
You have to have some fat to take, all right.
And then we put it where we want it.
Okay,
so
got it.
It's a combination of not only just enhancing the buttocks that's there, but also fixing the frame.
Okay, so people don't just come in and say, give me a bigger butt. It's actually, you can fix butt problems or you can just enhance the volume.
Yes.
All right.
Yeah, so it's the same thing with breasts. If someone has a nice shaped butt, but it's small, then we just kind of put a
add
little bit everywhere
fat.
and make it bigger, but the same shape. But if someone is missing the upper part or the outer part of their butt, but the inside's okay, we can just do the outside.
I like that. All right, let's take a look at pick number one. Remember, get kids out of the room.
Okay,
Here
so
we
this
go.
one, I have one with all the markings. So above the buttocks, you can see areas where I'm doing liposuction.
Okay.
So we're trying to take away those areas. And just taking that away helps. Because it gives us more of a sort of that
curve,
sort of hourglass shape rather than kind of a rectangular shape that she has before. Again, lower part, she has a nice fold already.
Yeah.
So I don't have to spend a lot of time there. But
You
laterally, it's dented.
Oh, that's
and
wonderful.
that's more of a masculine butt, which women don't tend to want to have on their butt. So
we want the curve.
What I've done is take the fat from above, move it down below, and we put it in with little tiny tunnels so it can get a good blood supply and survive.
And that's it? So we're talking recovery time, not much because you're not cutting, right? You're just...
The most difficult part is we don't want to sit on the area that we've just
you don't want to sit on it.
I have my patients sit up very, very straight, so they're more on the thigh, or laying down on the side or the stomach is better. But you can see the change in projection.
Pick number two, this is amazing.
So this is someone also had a tummy tuck, just for full disclosure.
Wow.
But the fat that was in the front for the tummy tuck, we would normally throw out. Well, I saved that.
Fantastic.
Took it from the back again, a little bit from underneath to curve out the bottom, and then just to fill. Again, not a bad shape, it's just not as much as she wanted.
Yeah, just need a little more.
So we can enhance it just
and that's
by adding
perfect,
volume.
that you can take it from the stomach where you want to get rid of it and put it in. And so when you gain weight or lose weight, it's going to gain and lose just like it was
Wherever it came from, Okay, so if you gain weight and your belly was going to get bigger, now your butt's
going to get bigger. Love that.
So,
pick number
similar
three.
Here, so again, taking away fat from the upper part, adding it to the lower part. I like this picture because it shows the little dimples that are in the butt.
Yeah.
Those tend to go along for the ride.
Oh, okay.
I always try to sort of release them and add fat behind them. They tend to get a little better, but they just don't.
So what
go
you're
away.
telling is we cannot really do anything about cellulite.
The little cellulitic stuff, it's still hard. I mean,
why can't they just cut the fibers?
Well, we do. When we cut the fibers and we try to fill it in with fat. If I didn't, these would look deeper.
Oh, okay. So you did fill them in a little bit, but they just don't go all the way.
But yeah, usually if we're trying to go after those, then that's all we're doing.
Yeah. Oh, okay.
And then this is someone who just doesn't have as much fat as I would like.
No.
But was still very, very happy because her butt almost went in.
Yes.
The back was so
full. So you gave a little volume coming out.
So again, it's taking away that stuff that's above the butt that makes it look like an inverted triangle.
Yeah.
And adding it so that we can get the widest point now sort of at the mid portion of the buttocks, rather than for her it was down at the thigh.
Wow.
Beforehand.
And last pick here.
And one more. And then we can do a lot.
Wow.
So sometimes people want a big dramatic statement. Not the most common result, but if somebody wants that, sometimes it can happen. So she was someone with a very thin frame. Her ribs were small. The fat was disguising it. So when we take away that fat, it reveals her smaller waist, and then quite a bit is put in down below.
She kind of wanted that Kardashian butt
distortion
on that one.
because the garment's still pushing up that left.
But that looks
right
really
side
good.
too,
And so you're telling me basically it's just liposuction. So the recovery time is sit on
it's like liposuction. It's sore like muscle ache soreness.
Okay, just for a week or two.
And then it's protecting the graft. So don't want to put pressure right on the graft.
That is amazing.
You want that blood supply to get set up and work.
All right, you can have your Brazilian butt lift. There you go. For more information about Dr. Mealy, you can call the office 925-943-6353 or check them out on the web at either drmealy.com, sanfranciscobreast.com. Lots more to come. Keep it right here on Body Beautiful.